Okay, for everybody else, you can be working on your own scripts and your own PowerPoints and all that stuff. Just be real quiet, be a good audience. Okay, whenever you're ready.
Hello, everybody. Our topic today is on vaccines and racism by Roman Earl, Ransom Call, Jake Lure, and Hayden Finn. Next slide, please. So, our research question was, is there a discrepancy found in vaccination rates among racial and ethnic groups? So the short answer is yes, there is a discrepancy. However, it's not tremendously big, nor is it exclusive to racial differences. In fact, it's actually more prevalent among poverty lines than racial lines. The chart that you're looking at right now, it came from a study regarding the racial and ethnic differences in vaccination rates among veterans who were enrolled in the Veterans Affairs healthcare system. This chart shows the reported barriers to vaccine access, such as medical advice not to want a flu shot, or just not want a flu shot, or don't know that you need one, and just other. And then the findings of this study was that blacks were 6% less likely to be vaccinated than whites, 75% of blacks as opposed to 81% of whites. Next slide.
This graph represents the importance of vaccinations and the reasoning behind vaccines. As seen here, the death rate of children has dramatically decreased since the year 1990. This can mainly be attributed to vaccinations. This graph helps to portray how great an effect simple vaccinations can have on a population. The colored portion of this graph are death caused by disease and illness. The gray represents unknown cases. The numbers of colored groups can be brought even lower by vaccination of children. This graph allows us to see the greatness of modern medicine and all it can do to prevent disease from spreading. Next slide. I will be reading Jacob's part. The first solution involves the cost of the vaccines and how the vaccine is distributed. One solution is to lower the cost of vaccines to make them more affordable for everyone on Earth, despite their color and race. As you may know, vaccinations can be quite costly and expensive. One dose of a vaccination can cost anywhere around $100. Sachiko Ozawa, who wrote an abstract about the cost of vaccines, states, as vaccine costs rise, competing priorities increase, economic evidence is likely to play an increasing role in vaccination decisions. Vaccinations and other crucial medical procedures are skipped by minorities and ones that do not want to use their money because of the higher costs. An author from the Consultant 360 writes, one solution to the problem of the upfront cost of purchasing vaccines is to use a universal supplier, either the state or federal government. However, this approach has not been 100% effective. The solution will make vaccinations more accessible and affordable in various countries and nations of the world that would not normally offer the vaccines. The impoverished poorer nations and people will be affected the most by making vaccinations more expendable and accessible. Next slide. This is my part. Unfortunately, there are some limitations to this solution. These limitations include that there is no way to ensure that everyone will receive these vaccines. The issues that doctors will not gain anything from cheaper vaccines, and lastly, that big pharmaceutical companies will lose money from cheaper vaccines. Cheap vaccinations do not ensure the fact that everyone will be able to afford them. Even with the reduced price, many still are unable to afford the upfront cost of vaccinations. Sadly, some physicians oppose the change to cheaper vaccines because there is less money to be made. Lastly, large pharmaceutical companies, or big pharma, oppose the change because there is far more money made in overpricing vaccines than making them more affordable. This holds great opposition and power because big pharma controls the price of vaccinations and medications. Next slide.
The second solution that we have proposed for our problem is making vaccines more accessible and available to the public by having them at more convenient and nearby locations. Samantha Artiga, a graduate from George Washington University, states that it will be important to make vaccines easily accessible at convenient locations and to ensure people know where and how to access it. This would help accommodate those with longer drives to doctor's offices, as well as those with busier schedules. Candace Lynn, a professor in the nursing department at University of Calgary, quotes that providing vaccination at school may be convenient for parents and might contribute to increased vaccine uptake, especially among rural children. This would help motivate parents to get themselves and their children vaccinated, thus increasing vaccine intake. This solution would nearly affect anybody, as it helps the general public who live in metropolitan areas, especially those who live in rural and suburban areas. Nobody would be hurt by this vaccine, but there would be a need for workers as well as assistants to work at these new locations. Next slide, please. The limitations for this solution include not having enough trusted or safe locations for these vaccines to be distributed to, especially in rural and suburban areas. This would be solved by buying more properties as well as building more properties, which would obviously cost a good amount of money. Another problem is that if vaccines are delivered in bulk, there is a slight chance that they are treated improperly and get contaminated and are unsanitary for use. And finally, there is also no way to ensure that that having vaccines at closer locations will increase people's chance of getting the vaccines. This could only be solved if there was an experiment or test done. Next slide, please.
This graph outlines different ethnic groups' support to one specific vaccine. This graph shows the need to eliminate discrepancies in education and vaccinations. This graph gives great insight into which ethnic groups are more supportive of vaccinations. An example from this graph is the Hispanic group, who have the lowest overall average, which means this group is the least supportive of all represented here. Next slide.
So the better solution of the two would be the first one, which is lowering the cost of vaccines, because it reduces the poverty factor of choosing to vaccinate by making vaccines less expensive. And this is a pretty big deal because the poverty factor is a major part of. It also increases the availability of vaccines, especially with a universal supplier such as a federal or state government who can universally supply vaccines to the people or to the citizens of a country or state. So this chart right here is from a study of vaccine coverage in children who are 19 to 35 months old. This bottom row right here is the estimated coverage for all 7 documented vaccines, which include MMR, polio, hepatitis B, and others. The most drastic of these findings is that only an estimated 62.8% of children below the poverty line within this age range receive vaccine coverage. And this shows that the discrepancy is not just racially exclusive. In fact, it's more prevalent among poverty lines than it is among racial lines. However, because blacks are more likely to fall under this poverty line, they are slightly affected more. So, next slide. And here are our work cited. Thank you.
Nice. Thanks, guys. You ran a little long. Stay up there. I'm debriefing you now. You ran a little long, but I could tell you were wrapping up, so I didn't cut you off.